You are listening to Personalization Outbreak, a podcast about the collapse of traditional corporate standards in today's more personalized world. I'm Llopis. I'm a leadership strategist, author, contributor to Forbes, and founder of the Leadership in the Age of Personalization movement. On this show, I'm interviewing executives across multiple sectors to find out how the balance between standardization and personalization can exist. Hello, everyone. Welcome back to Personalization Outbreak Podcast. Now, today's episode promises to spark very meaningful conversation about a crisis that so many of us overlook, yet impacts millions, millions of lives every day. That's caregiving. See, it's not just a personal responsibility, but it's a silent workforce challenge that companies can no longer afford to ignore. To dig deep into this very important topic, we're joined by Seth Sternberg, co-founder and CEO of Honor Technology. Now, as a leader in aging care innovation, Honor and its consumer care brand, Home Instead, are setting a new standard for aging in place, backed by powerful technology, compassionate care, and a commitment to help older adults age on their own terms. But Seth's story doesn't start here. A seasoned entrepreneur, he's the mind behind Meebo, a social platform acquired by Google, where he went on to spearhead game-changing advancements like Google Sign-In. But it was a personal experience with his mother that redirected his path and ultimately inspired him to take on one of healthcare's toughest and most overlooked problems. Now, Seth and I will explore the challenges slowing down the caregiving industry, from inefficient systems and caregiver turnover to socioeconomic barriers that leave so many families without proper care. We'll also take a closer look at how AI is transforming caregiving into a more human-centered approach, scalable solution, and how Honor's approach is turning this vision into reality. But before we get started, please click the like button below, share it with your colleagues, and subscribe to our YouTube channel and social media at Llopis. Seth, what an honor to have you on this show today. Appreciate your time.
Yeah, it's great to be here, Glenn. Thanks for having me.
Well, I think it's important that we let our audience know why I was so interested. I too sit in this sandwich generation, not only taking care of my own family, immediate family, but also my mother. In fact, 12 years ago, this is when I lost my father after he lost the battle with Alzheimer's. And now my mother's facing a battle with the recovery from a stroke. And most recently, she fell and broke her left hip. So I'm a testament to just how big of an issue this is, that quite candidly, most people can't afford nor have the time to manage. So what you're embarking on, and I share this with our listeners listening and those watching, that this is extraordinarily relevant because this not only affects your pocketbook, it impacts your lifestyle, and it could have an indelible impact on even your children. So the thread runs pretty deep here. So thank you again for your time, Seth. One of the things that I enjoyed getting to know about you, Seth, is how you enjoy building solutions that make complex systems simpler and more human. As you call it, those that actually sit at the intersection of technology and real human need, especially when the stakes are high.
Yeah.
So I'm going to stop talking here, Seth. When did you know this about yourself, and how did you develop the skills to actually practice it?
Yeah, it's a good question. So, when I was in my mid 20s, I kind of went through this existential crisis of why do I exist? And for a while, I decided, well, it just must be to have fun. But then I realized that anything I thought was fun, if I did it 3 times in a day, it would become boring. And so like just a life of fun seemed therefore boring and not the reason I existed, obviously. And then I decided, the only thing that would really keep me motivated, right? Like the thing that would keep me going and pushing through hard things was if I knew that the stuff I was working on would like truly help other people. Um, And this is, also coming from a place of, from a pretty young age, I founded a company that had made me enough money that I individually realized that after you have a certain amount of money, you don't care anymore, or at least I didn't. And so, you're not striving for a title, you're not striving for money. So what's the thing you're striving for? And at least for me, it was definitely not fun. It was not sit on a beach. It was simply make other people's lives better. Um, and then, to me, I have this big thing about kind of justice and fairness. And I really hate it when I see people who are kind of born into situations where they're just unlucky, right? It's just by dint of the way they were born or where they were born or the country or their parents or whatever. They don't have this access to the same opportunities I do. And so I wanted to be able to work on things where I felt like if I did that, I would help improve people's lives. So elder care, when we came upon honor, it was because of an issue with my mother, like just a little vignette with my mother where we had the idea. But what I loved about it is you're helping kind of three populations. You're helping people like you, right, who are in the sandwich generation, who are often caring for an elderly person like their neighbor or family member or parent or whoever it might be. And then also their kids, right? Often they have kids too. And so that's what we call a sandwich generation, sandwich between kids and parents. You're helping the parents, right? You're trying to create better, more accessible care for older adults. And then you're helping the care pros because, I think people too often overlook this massive population of what we call personal care aides in the government statistics. We call them care professionals. And that is the largest single workforce in the United States of America now. They just passed retail workers as
Mhm.
the number one workforce. And it's also growing at an astronomical rate because of the aging of society. So if we could, launch a company that helped three distinct groups of people, that would, from a selfish perspective, keep me motivated when you hit these really hard brick walls that you always hit when you do startups. And I guess the other thing I'd just say on this, on this topic is, I'm sitting in Silicon Valley as we have this conversation. And I really wish that more startups coming out of Silicon Valley worked on things where you could just draw a straight line to like human good. There are so many problems, right, around kind of how this current state of humanity and where we are as a society. And I think that technology for good can be a real thing. But I think too often it just feels like it's technology for money. And that's not motivating for anyone, I don't think.
Well, let's go back to what you said, that you reached a point in your life um, where you didn't have to care anymore,
Mhm.
but yet it was caring that brought you to this work. In other words, you realized that you started to care for the things that truly mattered.
Yeah,
And
I think
go ahead.
everybody, so everybody has their own set point, I think,
Hmm.
on where they stop caring about material goods or they stop caring about, you know, titles, right? It's kind of classic money power. And there's a model that kind of says people either seek money or power. And it just turned out that, frankly, my set point on both is low. Like, I don't actually care that much about either. And I got enough of both, I guess, for me that those were no longer motivating factors.
Yeah.
And so I just think that the thing is once someone passes those motivating factors, it's really interesting to watch that individual because some people, pass those factors and they immediately just go on vacation for the rest of their lives. Other people party constantly, just like, I know people like this, right? They just like kind of go into literal party mode. And other people kind of go into, no, I'm just going to go do it again and I'm going to do it even harder because I'm positioned to be able to take more risk.
Hmm.
That risk isn't so that I can make more money. That risk is so that I can have more impact. And, for me, it turned out that that was the only thing that was actually motivating is, take more risk around, therefore, disproportionate impact with that risk.
How can you? So before we get into your mother's story, because I want you to go deep into that one, What's the lesson here that
Uh,
you've just shared?
I think that frankly, the lesson is people, like everyone's just really different. And everybody has like very fundamentally different motivators that drive them. Um, and I never understood that when I was younger, right? And now it's a thing that I deeply understand. And if there's actually a lesson in this, it's very, very hard to change the underlying driver for an individual. And, when I interview people for roles at Honor, it's a thing I actually try to come to understand. Like I ask questions around why are you who you are? What's your background? And I'll
Mhm.
often get an answer like, well, I love to learn. And it's like, okay, well, why do you love to learn? Where did that come from? Because I'm really trying to understand what drives a person. Um, and if you're trying to do something very, very hard, people who are not intrinsically driven around world change will tend to quit, right?
Mhm.
Because they're just like, look, there's an easier way to make money. There's an easier way to whatever, right? To be able to be on the beach, half the year. And those are just not good people for what we're doing, right? But they could be great people for other stuff. So I think the lesson is actually that everybody's just different and you need to understand that. And then kind of know that when you interact with other people that they have certain motivators that might not be similar to your own.
Well, I think part of what not just makes you different, but helps you really stand out is that not only do you care, but you are extraordinarily authentic. And I think that your motives behind doing this are very real. And you're also very, you're quite humble about what you've achieved, but also realistic on where you're at in this journey with honor. So that within itself should be a motivation for people who are watching that even someone that has already quote unquote made it according to the American standard is just a startup.
Yeah, well,
And and I think there's a lesson there too.
I think I think a thing that, for the broader audience that people could take away, because this is how I got there for myself, is, there's this really easy model of if you think about your own self when you know you're 2 weeks away from death. And at that moment, you look back on your life and you say, do I feel good about the life I lived, right? Am I proud of the life I lived? Am I happy with what I did? Because at that point, there will be no money. Money won't matter. You could be a billionaire. You could have almost no money. It like the next 2 weeks don't matter, right? It at that point, what do you want to have accomplished? And, in my world, it actually is that's how I came up with this actually. And it became very simple. Like impact on making people's lives better and a happy family. Like if I set my kids up for success, if I had a good relationship with my wife, and if I built a thing that had kind of impact on people who are less fortunate than I am, that's a fulfilling life. Like that's, I think, all you could really ask for.
I agree with that. I agree with that on so many levels. So tell me more about the story about your mother and how this really inspired you to jump into this, you know.
Yeah. Well, there's the famous Andy Grove book, Only the Paranoid Survive. And I do think that that is just like a consistent personality trait amongst entrepreneurs. And I definitely have that personality trait. And so, the way so we had sold our first company to Google, and then the same founding team, for the most part, was brainstorming what to do next. And we had these
Hmm.
rules, like it had to be look a human in the eye and make their life better, millions of humans, not just one, a hard problem because we were positioned to know how to do a harder problem because we built a company before. Um, a big enough problem that it could be a legacy company, by which we meant it would outlive us. And so this turned out to be a very hard spec to fill, like just really hard to find the thing that could fit.
How long did that take? How long did it take to do
18
that?
months. It took 18 months. And what ended up happening is I we're like brainstorming whatever. I fly to Connecticut and my mother picks me up at the airport and she's just is driving me home and she's just driving slower than she used to drive. That's all it
Hmm.
was. But the thing is she used to get like when we do our out west trips, she'd get speeding tickets in Montana kind of a deal. So she was a total lead foot. I inherited that from her. I've slowed down a little bit in my older age, but as a kid, I would have the same problem. Um, and I said to her, I was like, Mom, why are you driving so slow? And she just said, well, driving's just harder than it used to be. And that was the paranoia moment, right? It's like, ooh, in 5 years or 10 years, what does that mean? And so that's when I kind of came back and we didn't know what it was. It just said like, look, guys, like tech ignores older adults. Like I'm pretty sure, the aging population is growing really fast. So it might be a big opportunity and like no one's doing it. We should dive in on this. And then, being who we kind of are, the ambition became very large. The ambition became, how could you really fix the way society cares for older adults? And that's way too big to kind of bite off as an entrepreneur. You got to narrow that down. So we narrowed it down into let's fix how people can stay at home as they age, which is called aging in place, and that's home care. And that's how Honor was formed.
So, what did you learn about what this aging population didn't get enough of from a healthcare standpoint?
Yeah, so the problem is it's like almost everything. So
Hmm.
society has kind of a fixation on youth. And that's ironic because if you look at the statistics now, by the year 2034, there will be more people over the age of 65 than under the age of 18 in the United States of America. And like let that sink in, right? Like more people over 65 than under 18 by
Wow.
2034. But I guarantee you, 95% of people are going to be out there still building stuff for kids or young adults, as opposed to thinking about how to take care of this like massive, massive population of older adults. Um, and so, you know, the when you then, because of the lack of kind of focus on that population, and because that population does end up having just straight up unique needs, like it becomes difficult to get out of your chair, like eyesight will decline, driving at night becomes harder. You can't just order, Instacart to your front door because like getting to your front door and getting the milk is hard. So there's all these issues that turn out to be really hard. And as you go kind of industry by industry, service by service, you discover really hard. Most of them actually do not work for that population. And yet, you've got a situation right now where a whopping 4% of older adults live in kind of communities for older adults. Everyone else is at home, right? So, like, we have to fix the how do you take care of an older adult and allow them to live their lives within their home because it's where 95% of the population lives, right?
So, going back to the this ratio about older and those 18 or 18 years old, where do you think the caregiving industry went wrong?
Yeah.
Um, because I'm sure you found something that said, wait a second, how did they miss this? How did they miss this? How did they miss that?
Yeah. So, yeah, there's the industry of like home care, which is what we went into. And what we saw when we went into it was massive industry, like $30 billion in America alone. So big, big. But hyper fragmented. Just like no, it's all these local agencies, and then that has all sorts of problems around quality and quality of job for the care pros, and has all sorts of like negative implications because it's so fragmented. But what you saw was the service is so personalized and needs to be so personalized that it was like software wasn't helping it scale. So like people had built software to try to help it scale, which has classically been an approach that helps industry scale, like manufacturing kind of scaled through software.
Mhm.
Building cars kind of scaled through software. Like these, like people built software and it let you do a thing again and again cheaper and boom, it worked. And in certain industries, though, it doesn't work. And home care turned out to be one of them.
Hmm.
And it turned out that like when we launched Otter, we just said, hey, look, like we don't totally understand why this thing never scales. We just know empirically it does not scale. So let's just launch a home care agency and figure out why it doesn't scale. And by the time we hit like $10 million in revenue, the wheels were just completely falling off the bus. And I thought we'd have to shut down. I thought like this is not a technology tractable problem. It's too personalized. Like, why does Mrs. Smith love CarePro Janet, but Mrs. Jones hates CarePro Janet? Dunno, can't do 5-star ratings. That's not going to work, right? She's going to have a 2.5, but the reality is she's good for one person, bad for another person. But then it turned out 10 years ago, we figured out that AI was effectively the answer. So you actually needed a breakthrough in technology. You needed a different way to do software, AI,
Hmm.
in order to be able to scale and solve a lot of these problems. And that's because AI can handle kind of why does Mrs. Smith love Janet, but Mrs. Jones doesn't. AI can do that, but static algorithms can't. And that was kind of our big unlock 10 years ago.
So, a question, because I've, having been dealing with this for some time personally, I felt that the personalization for my mother and father happened because of myself and my wife being part of creating that match.
Yeah.
But I know that that's not always the case,
Yeah.
right? How many families do you see being actively involved in trying to not just onboard, but making sure the continuity of quality care exists? What
Yeah.
did you learn? What did you learn in those first $10 million?
Yeah. So families are very, very often involved. About 80% of the time, actually, families are involved.
Hmm.
The challenge is that so families often actually want to be like super involved. They want to be the people who like you do the in-home consult with rather than their mom being there. And we actually disallowed that because what
Huh.
we found is the kids, of which you and I get to be kids, right? We're kind of old kids with gray hair in my case, but um,
Mine too. Go ahead.
um, so the kids actually often don't know what mom or dad really need, and mom or dad often hide it from the kids.
Hmm.
And so you've got this interesting challenge of how do you really hyper personalize for the actual needs of that older adult? And so the way we deal with it is that we send a person into the home, we do a consult in the home, and then because we are able to use AI, we will back pattern match. It's called a lookalike. We'll kind of say, hey, this situation with these needs and this family dynamic and this place, blah, blah, blah kind of looks like, out of the million plus that we could draw from, kind of looks like these 50. And then you say, okay, well, let's like start serving the person based on that kind of look-alike, like those 50. And then
Mhm.
as we serve that person, we can get better because we can start to recognize, oh, okay, like they're going to go into this swim lane as we observe more specifically about them.
So, how is tech in general transforming the industry? What's next, do you see?
Yeah, I think the big thing, so I think there's two things that we're going to see. It's a great question. I think one thing that we're going to see, so the first, let's say, okay, what did tech do, right? What have we done with tech? And what we have done is we have made it possible to actually scale home care, which means, for example, you can have 1,000 care pros in a geography, which means we can be more likely to staff faster with the appropriate person for your mom. And that's a novel unlock, and we did it. Then I think there's two other things technology is going to do over time. The first is it's going to enable more comprehensive care for mom by integrating other services in a kind of really svelte and efficient way so that pricing can go down. So, for
Mhm.
example, how do you get food into a home? I think you can do it actually pretty cheap if you have a technology-driven care delivery system. So
Hmm.
one is integrate additional services, food, drugs, healthcare, et cetera. I think the other thing food is going to do, or sorry, food is going to do, tech's going to do, is just drive down the cost of care, period. Because you will find efficiencies and you will also find ways to integrate with devices in the home that will make it such that we can kind of reduce the total time a human needs to be in the home. And so therefore reduce the cost and open up the ability to pay for care in the home to many, many more people. It'll actually create more jobs, right? Because what you'll have happen is let's say you're able to reduce the amount of human in the home by 50% because you're
Hmm.
using devices to like monitor for safety and order things
Yeah.
ever in the appropriate way. But then maybe you 4x'd the total number of people who can afford to get care in their home now. So you actually
Yeah.
just double the number of jobs, right? So
Yeah. Makes
that
sense.
is super exciting. This idea that technology can help many, many more people stay in their homes at a lower cost.
So, as you've scaled through AI, how are you scaling talent?
Yeah, so talent, well, it's kind of like which talent pool, right? We have so many.
Yeah.
There's one kind of talent, which is engineering and data science talent, which kind of builds the AI.
Mhm.
And that's really, it's actually like a fixed cost in the sense that the team kind of stays the size that that team is. And you
Mhm.
can add engineers here and there to be able to work on more projects in parallel. But you don't scale it with the rate at which you grow the service. Care pros, we are hiring thousands and thousands a year. I mean, just constantly hiring care pros. I think the stat is we review something like 200,000 resumes a year, or something crazy.
Oh my
Yeah.
gosh.
Constantly scaling care pros because there's a constant need for more care. And then you have kind of your operations team, and your operations team does not need to scale at the same rate as your service provision scales because the technology does allow for greater efficiency over time.
Okay, I have to ask because these are the biggest challenges that I had in evaluating, uh, as you call them, the care pros. Is it that more people want to pursue this career track, or are you technically taking them away from competitors? I mean, how are you finding these people?
It's really both. I mean, so we
Because it's hard to find
very,
quality
very hard. Yeah.
caregivers. Very hard.
So here's what I kind of say to people. So we have like, big demand funnels that like post on the internet and run ads and all this kind of stuff, and then it produces a whole bunch of resumes and people apply and then they, get in and screen and all kind of stuff. But often people will say, well, look, there's just like a shortage of care pros, which is actually true. Like, industry wide, we need more care pros than we have. And like I said, it's the biggest employment category in the United States. At the same time, it's one of the fastest by percentage growing categories, which is insane to be both the biggest and one of the fastest growing. So that means we need more of them. But even us, we're like 2 to 3 times bigger than the nearest competitor. And we only have 5% market share, which means that for every, five care pros that we employ, someone else employs 95. And so our job is to create a better job so that those 95 people want to come work for us, right? Like that, for us, it should not be, oh, there's a shortage of care pros. It should just be, look, we're creating a better job. We're creating a better life for care pros. We're creating a more attractive place for them to come work. That means we can attract the best ones, and then that means we can provide the best care, right? So that's the way I think about it, kind of from a selfish perspective. It's like, let's just create an amazing job. We call it care for the care pro, so that we can then create better care. And that's that for us for a while, since we only have 5% market share, is a winning formula.
So, what is it, if you can just point out maybe a couple of things to give our audience a perspective? Where did you find that those two or three things that that caregiver lacked that didn't allow them to provide the quality that
Yeah.
families and patients expected? And then what did you do to fix that? I mean, I can't assume you just brought in people and you thought, well, they're better
Yeah.
because you took them through an interview process. You must have done something to change how they were doing the work to get the quality you're looking for.
Yeah. So yeah, great question. So when we started Honor, before we launched anything, before we even incorporated, we interviewed about 25 care pros in Sacramento, California, and 25 in Phoenix, Arizona, in local Starbuckses. And we just, we put out an ad, said, hey, we'll pay you, I forget what, and, can we interview you? And the stuff we heard was just like nearly heartbreaking. Like we heard like, I'm a professional, but I'm treated like crap. And I just want to be treated like a professional.
Yep.
Something as simple as how are they treated, right? That's actually why we started calling them care pros. Like they want to be care pros. They are professionals. Let's call them what they want to be.
Perfect.
And and the industry has a bad habit of calling them unskilled because they're comparing them to like a doctor. And it's like, wow, that's great. Let's call people unskilled. Good job, guys. Like that's not, how you motivate someone. Another story we heard so much was, um, I'm scared when I walk into the door of a client's home. Like I'm being
Hmm.
sent to a home. I don't know what's behind the door. It's scary. Is there a dog? Is there a, strange son-in-law, whatever, right? Like scary. So we did a lot to kind of ensure that there was a lot of visibility for the care pro before they walked in on what that home would be. And then a really big thing, and this is where AI plays a big role, is what kind of job, both from like a work in the home and from a geographic location and from a schedule location, does a care pro really want? And if you can put that care pro into those kinds of jobs that they really want, they have a much more fulfilling time and they will perform better. And then I guess the final one that really people just miss, and so important, is you've got to provide stability in pay. So, what happens in this industry because it's so fragmented is care pros working 40 hours this week. Next week, one of their two clients moves into a facility and boom, they get a 50% pay cut.
Mhm,
And that's
mhm.
devastating, right? And so what you need to do is you need to be big enough. This is where scale matters so that you can get that care pro the backfill hours next week so that they don't take a 50% pay. Like, how would you like to take a 50% pay cut next week, right? You wouldn't.
Yeah, of course. Yeah.
Neither would anyone, and neither do they. So that's a really big deal too.
So, first of all, you have a lot of golden nuggets to teach the healthcare industry, and particularly in hospitals. And I want to make an observation here. And I'm going to say this slowly because the audience has heard me talk about this, but you are a prime example of it. And great job. I'm getting goosebumps really because I know what's happening here now. You've realized that the patient, it's a very personalized part of the model.
Mhm.
And you get that and you saw that and you found a way with technology to scale it.
Mhm.
Good for you. But what you've also done is you've realized that if we don't start personalizing our care pros,
Mhm.
we can't provide what our clients need, which means what? The people, by the way, a lot of these things that you've identified, these are blind spots because they care about the consumer, the actual, in this case,
Mhm.
uh, the people that they're selling the service to. But the very people who are delivering the service has been ignored. And you saw that and said, wait a second, we're going to give them back their dignity
Mhm.
that they lost years ago in this industry
Yeah.
and make our competitors in put them in a position where they're not even going to figure this out until word of mouth gets out. I mean, this is what has been missing in all industries. We don't realize that both the pay, in particular in healthcare, that both the patient and the employee are both consumers. They have options. And what you've done is you've elevated the value of your own employees or care pros by just giving them what they need. That's it.
Yeah. That's the goal.
I mean, well, and you make it sound so simple, but I'm taking the time to explain what you've done so masterfully, you and your team, because this is what's missing in industries.
Hmm.
They don't care about the employee. It's about what more that employee can do for me the way I want them to do it, to give what I think the client wants. And what you've learned is that now you know what the client wants based upon AI technology, and you're almost reverse engineering that to make sure that the very care pros have what they need to do it should that our brand expects our clients to have. Anyway, thanks for letting me have a little time there. But I think what you've hit on here is so important.
Yeah. Well,
So important.
yeah, no, yeah. I mean, it was an yes, I totally agree.
I mean, it's a game changer. It's a game changer. And I'm sure you'll already start to find ways to integrate AI to find ways to get out in front of what those care pros need so that they never have to ask you.
Mhm. Oh yeah, trust me, there's a lot of forward prediction stuff.
Of course, of course. So let's go and talk about this big audience that really needs your service here. And I'm sorry, I'm going to be a little bit selfish here for you because I see this in the employer world every day. I mean,
Mhm.
you've got different populations, many populations in the workplace, let alone generation shifts, but more people like us who have had parents that are now getting close to this situation, and they're not even close to preparing for it.
Right.
So, as more people take on these roles, how big of a challenge is this for becoming employers managing these impacted employees, and what would you recommend for both the employer and for the employee?
Yeah, that's a good question. So, there's a stat that about 1 in 5 employees is probably caregiving for an older adult due to older adult issues. And that person also is probably in the sandwich generation, right? So they're both taking care of kids and they're taking care of a parent. And the reality is employers are missing out on workforce productivity as a result of that, right? It's a silent kind of hidden thing. They're also getting churn, right? They're losing good employees that they then have to pay a lot of money to kind of replace. So if I were an employer, just like and this is the point we were talking about earlier in this conversation, just like I've built kind of probably some kind of benefit around childcare, I would build some kind of benefit around parent care, right? Like,
Hmm.
hey, we are going to help you with, either one-off emergency, like 10 days a year. If you need, kind of some kind of service to come in and take care, it's called respite care, sorry. Take care of your mom or dad or take your mom and dad to the hospital or whatever it might be, we're there for you. So that's one thing that people can do. The other thing that people can do beyond having that benefit is to partner with some kind of company, right? So there are a number of companies out there, or us. You need a nationwide company, because you need one where you're an employer in Boise, Idaho, but you recognize that the parents might live all over the country. So you need to find a company that can say, yep, like for all your employee population, for the dramatic majority of the parents, no matter where they are, we could help them and help provide that benefit. Um, so those are probably the biggest things is like help create a funnel for your employees to know how to get the help and also kind of a financial assistance program, just like people already have for kids. And the ROI should be absolutely positive, right? The ROI should be, yay, now my employee can actually pay attention. They're not less distracted. They're less likely to churn, as a result of putting that in place.
This is so wise of you. And I can remember, and I'll tell you why. I remember in 2019, when I first started this whole movement around leadership in the age of personalization, we started this podcast. I told a group of about 200 executives, everyone is now in the healthcare business.
Yeah.
And there was silence. What do you mean we're in the healthcare business? I guess you can say that, Glenn, because we provide benefits to our employees. No, 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 no. It goes way beyond that. And I think this is what you're pointing out is that rather than employees who already feel the pressures of doing more with less and every health related issue that comes from that, there's this issue. And
Yeah.
to even bring this up, um, and by the way, I know plenty of leaders who don't even talk about it, but will just do it without anybody knowing because
Uh,
they have to.
yeah.
And so when you talk about this silent, you know, thing that's taking place, what you're suggesting here is a must, and it should have happened probably 10, 20 years ago.
Yeah. Yeah.
But do you think that employers are prepared for this?
Yeah, so as you say this, what I'm kind of thinking to myself is fundamentally in the United States, the system of paying for healthcare is actually employer, right? Like employers pay
Mhm.
for healthcare.
Yeah. Mhm.
And I think that if an employer actually, and I know, like as being the CEO of a rather large company now, our rates on how much we pay for healthcare are a function of how much do our employees utilize healthcare.
Mhm.
And so I just think there's this reality that if you think both about what are things that I can do to make my employee population healthier, which is to say less prone to spend in core healthcare where things are really expensive, and also what are things I can do to make my employees perform better, and what are things I can do to retain my employees. And you really think about it as like an actual function that matters as opposed to a must because the government mandates it,
Yep.
kind of the bare minimum, but then you might not get the benefit out of actually investing more, right? Like the stuff the government mandates, your costs go up if you don't manage it well, the core healthcare stuff. But if you manage the whole employee well, you might find that those government mandated things go down in cost productivity goes up, churn goes down. Like you might move all of the kind of stats that matter in the right direction and end up with actually just fundamentally better company performance as opposed to even just looking at a singular statistic like churn.
I hope everybody picked up what Seth just said, that if you are proactive in creating an environment at work where people feel as if the employer is doing, is allowing their people to operate and do their work in a way that personalizes what matters to them, then everything trickles to what Seth is recommending that the employer should do in advance for their employee as it relates to uh, this conversation. So if you go in standardizing your employees to think about what they need to do based upon what they're told, they're never going to get to this point of having the right conversations. And I think that this is what I see as an unlock on what you're doing, that I actually think, again, just as I'm listening to you, maybe you're going to be the one, your organization is going to be the unlock to start having organizations start personalizing what matters to their employees. Because as healthcare becomes a bigger and bigger issue amongst employers, they're technically being forced to.
Right. Mhm.
You see where I'm going here? So anyway, I love where you're going with this. And as we get closer to wrapping this up, Seth, what's been one key lesson your work with Honor has really taught you about the importance of personalization in the caregiving space? Because as I listen to your story, I feel like there's several things.
Yeah. Well, I mean, so like literally you cannot do okay. The benefit of being private pay is that your customers get to vote with like their wallets, right? They can just choose to switch from one provider to the other provider.
Mhm.
And their demand of the quality of service and the personalization actually of the service is just much higher, right? Because it's not a free service that they're given. It's a I get to pay, so therefore I get to choose. And so you learn very quickly that if you're running a private pay business, personalization is like literally everything. Now, the good news is that AI truly is like the ultimate personalization engine, right? It is the way to figure out what does this individual want versus that individual want. How do I give them more of what they want so that I have a happier customer, a happier care pro, a happier, employee in HQ? So I think that's probably the most important lesson is there's a way to do it. And when you do it, be you private pay or be you reimbursed, you will have a better, higher quality service with happier ultimate customers.
Makes a lot of sense. Makes a lot of sense. So, Seth, what final thoughts do you have on for people like myself,
Mhm.
because they're out there, a lot of them that haven't quite figured out even how to evaluate the right caregiving partner.
Yeah.
And because I think this is part of, what I went through is you talk to 10 of them and they all sound good. And then you start going into it talking to, clients that have used them and you start getting another story.
Yeah.
Uh, how do you, what would you suggest? Because again, you're not going to do this, so I will. I mean, you're really have broken the glass. I mean, you've taken this industry to a whole other level. But so again, what should people be looking for and how should they go about it?
Yeah. I mean, I think it's really hard to compare one provider to the other right now. Um, and what I would tell people, and that's because fundamentally everybody says, "Hey, I have great career pros. Hey, people love me," right? And but the actual service that they can say they deliver is actually the same. And it really just does come down to who can do a better job of getting you a higher quality care pro, who can do a better job of making sure that if that care pro becomes sick or if calls off last minute, that they can backfill that care pro, so that someone still comes and helps your mom get her, lunch that day. And interestingly, if there were just like the easy shortcut question that I would ask, if I were a client, it's just how many clients do you currently have in my market? And that tells you really fast, like, are people sticking with that particular provider? Does that provider have the scale to be able to find a backup care pro if someone does call off quickly so that someone can still get to mom's home? It's just the easy shortcut question, right? And it tells you a lot that's otherwise very hard to reveal.
Now, on that note, is there, again, forgive me for not knowing this, but it- do you have an app that people have access to that kind of follows, the opportunity for their people, for
Yep.
their parents? I mean, how does it how's it? The reason I'm asking is that I wish I had one with the people I've been working with, but what's it do? And tell us a little bit about the functionality, because this is important, the communication uh, part of this whole equation.
Yep. So our go-to-market brand, like what consumers are buying us under, is Home Instead. So we own the Home Instead brand and the Home Instead network. And when people are using Home Instead, there are a couple of different technology platforms that our offices are on. They
Mhm.
all have an app that consumers can use. The
Hmm.
offices on the latest technology, which we're bringing to more and more offices, give people really high fidelity in what's happening in home. They know what the schedule is. They know what care pro is coming. Everyone is seeing throughout our network, notes on what happened after a visit with their, mom or dad or loved one. So yes, there's an app that kind of lets you see this is what's occurred. These are the notes the care pros left. This is the schedule. Here's who's going to come to the home next, etc.
Hmm. No, the reason I ask is that right now, with the exception of, the private areas of my mother's home, I just got some Ring cameras up there.
Sure.
So, I mean, so you got to have a system to actually see or know what's
No.
really going on. And again, I'm just, this is really for the people who are listening and who are considering things, but it's the a lot of this is just the communication,
Yeah.
and that there's high trust,
Yeah.
because unfortunately I've seen things that they said that they did, but they really didn't do. And
Yeah.
unfortunately, that is a byproduct of this industry that I'm sure you have figured out how to avoid.
Well, it's just like it can be scary for a care pro to walk into a home.
Hmm.
It's scary for kids because they don't actually know what's happening in mom's home, especially if mom has dementia, which 50% of our clients do.
Wow.
And so, you've got this kind of black box dilemma, and it's a thing that actually the home care industry struggles with, because if you go talk to a normal home care operator that does not have the benefit of our AI technology, they'll tell you, well, their quality's great. And then you'll say to them, well, how do you know? And they'll say, well, I just know.
Hmm.
And that's very different from I'm gathering a whole bunch of data all the time and correlating it with performance of high quality care pros. And I know because the statistics are very clear based on the pattern of what's happening in the home and what's happening in the app and how the notes are being left and how the care plan's being followed. It's really different. So demystifying kind of the black box of the home turns out to be a really big deal, both for the care pros and for the kids, and for the ultimate quality that the older adult is receiving in care.
To wrap it up, you had mentioned something caught my attention just now, that 50% of the clients have dementia.
Yeah.
What does the other 50 represent
Yeah,
in terms
so
of state
it's
of
really
care?
interesting. If you look at kind of what do people need our help with, mobility is often a core issue. So
Okay.
it's hard for me to get up myself. It's hard for me to get into a shower or bath myself. It's hard for me to go to the bathroom myself. It's hard for me to make food myself.
Mhm.
So mobility is another one. And then mobility can stem from lots of stuff, right? It can be I have MS. It can be I'm
Mm.
just simply older. It can be I'm overweight, whatever it might be. So at core, you have these things called ADLs, activities of daily living. And those are things we do all day, every day. And typically, if you cannot do two ADLs, you cannot live alone without
Mm.
help. And so typically our like basically all of our customers, like probably 90%, cannot do two ADLs. And that's why we're there. And then the core thing that drives that I cannot do an ADL tends to either be a cognition thing or a kind of physical capability thing or a combination of the two.
Okay, I've got one more, and I'm done. I promise. You've been wonderful and gracious with your time, but again, I think these are things that people can benefit from. Why caregivers versus assisted living?
Yeah. So assisted living's really, really tough. Like I said, only 4% of the older adult population lives in kind of an older adult setting. If you go up into the 80 plus, it goes up to 10 to 15%, but that's it. So there's this issue of how do I pay for it, right? Like it's expensive because I have to like sell my place. I have to buy a new place and then I have to pay for the service fees after I've bought that place. It's also not where people are naturally comfortable. Like when you poll people and you say, where would you like to age? 93% say I want to age at home. And it's because it's what people are comfortable with. And if you actually, to the dementia point, if you take someone who has dementia and you move them to a place that is not familiar, they actually tend to go into decline faster. So,
Hmm.
moving someone from familiar to unfamiliar can actually be very bad for them. So both like from a health perspective, but also from just like a dollars and cents perspective, we must societally figure out how to care for people in their homes. We're not even building new assisted livings. The stats basically that they're flat in total volume while society is aging massively and only 4% of people live there. It's like we're effectively out of capacity anyhow of assisted living or, kind of older home living. So we got to figure out the home, and that's what we're working on.
Seth, it's really been a pleasure. I really, really appreciate your time and your insights and just for taking on this this mammoth endeavor. And I'm so glad that you're finding success and really helping reshape the industry because it's not just about you winning, but people learning about what you're doing so that the industry wins and the family wins, and then we give these older people their dignity and better quality of life. So thank you very, very much for your time today, Seth.
Awesome. Thanks for having me, Glenn. Appreciate it.
And as we leave every show, when you lead in the age of personalization, you will see things that others don't, do what others won't, and keep pushing when prudence says quit. Seth, thank you so much.
Thank you.
Thanks for listening to Personalization Outbreak. Make sure to subscribe so you never miss a show. If you enjoyed the content, visit ageofpersonalization.com to check out our free streaming video series and learn how to get involved in the movement. I'm Glenn Llopis. I wish you a good day, and remember, without strategy, change is merely substitution, not evolution.